Hello, I'm Maruk Said, your microbiology guide. Let's explore in-depth micro techniques and uncover groundbreaking insight together on this educational journey into the fascinating realms of microbes.
Rhizopus species. Explained. Bread mold under microscope, morphology, diseases, and industrial uses. Table of contents. Introduction to Rhizopus species. Habitat of Rhizopus species. Morphological and cultural characteristics of Rhizopus spp. Pathogenesis of Rhizopus species. Clinical manifestation of Mucormycosis, zygomycosis. Laboratory diagnosis of Mucormycosis, Rhizopus species. Treatment of Mucormycosis. Selected species of Rhizopus and industrial uses. Introduction to Rhizopus species. Rhizopus spp are saprophytic fungi that primarily grow on plant matter and can also exhibit parasitic behavior in animals. These fungi are multicellular in nature and consist of approximately 8 different species. Rhizopus species are known to cause an opportunistic infection in both humans and animals, referred to as invasive mucormycosis. Certain species within this genus have industrial significance. For example, Rhizopus stolonifer is well known for causing bread mold. Infections caused by Rhizopus may occur as complications in individuals suffering from ketoacidosis. Phylogenetic studies have identified 8 species within the Rhizopus genus: Rhizopus spp, Rhizopus delamar, Rhizopus microsporus, Rhizopus cespitosus, Rhizopus arizus, also known as Rhizopus oryzae, Rhizopus reflexus, Rhizopus homothalicus, and Rhizopus stolonifer. Among these, the medically significant species include Rhizopus oryzae and Rhizopus microsporus, which are commonly associated with clinical infections. Habitat of Rhizopus species. This species is a cosmopolitan group of fungi. It is found on a wide variety of surfaces, on organic substances like soil, decaying fruits, grown fruits and vegetables, jellies, tobacco, peanuts, leather, bread, and syrups. They are also found in animal feces. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. Morphological and cultural characteristics of Rhizopus spp. Rhizopus species grow as filamentous fungi, characterized by branching hyphae that are coenocytic, meaning they are multinucleated without septa. The branched hyphae in Rhizopus are classified into 3 types: stolons, horizontal hyphae, pigmented rhizoids, root-like structures, and unbranched sporangiophores, specialized spore-bearing stalks. In the case of Rhizopus microsporus, both macroscopic and microscopic morphological features can be observed. Rhizopus species are capable of reproducing both sexually and asexually. During asexual reproduction, they produce sporangiospores, which develop within a spherical structure called the sporangium. The sporangiospores are typically globose to ovoid in shape, single-celled, and range in appearance from hyaline, transparent, to brown, with a striate, striped or grooved texture. Sporangia are produced in large numbers. They are dark in color and are borne on long stalks, known as sporangiophores. Sporangiophores originate from the pigmented, root-like rhizoids and are rounded in structure, responsible for producing a high number of multinucleated spores. Sexual reproduction involves the formation of dark zygospores, which result from the fusion of 2 compatible mycelial strains. These zygospores later germinate to produce genetically distinct offspring, differing from the parental strains. Rhizopus colonies exhibit rapid growth, quickly spreading across the surface of the agar medium. As sporulation progresses, the fast-growing colonies transition in color from white to dark. The texture of these colonies is dense and cottony, often described as candy floss-like or fairly flossy in appearance. Pathogenesis of Rhizopus species. Rhizopus species are capable of causing infections in animals, humans, and plants. In humans, infection by Rhizopus spp is referred to as mucormycosis, which is also known by the older term zygomycosis. In plants, Rhizopus species are responsible for causing various rot diseases, which primarily affect harvested fruits such as strawberries, tomatoes, sweet potatoes, tobacco, papayas, and stone fruits. In human and animal hosts, the pathogenic condition caused by Rhizopus spp is mucormycosis, zygomycotic infection. The primary causative agents of this infection include Rhizopus erizus, Rhizopus oryzae, and Rhizopus microsporus. Transmission typically occurs through the inhalation of airborne fungal spores, which become deposited in the paranasal sinuses and lungs of the host. Several risk factors contribute to susceptibility, including diabetes mellitus, malnutrition, malignancies such as lymphomas and leukemias, renal failure, organ transplantation, burn injuries, immunosuppressive therapy, cirrhosis, and AIDS. Patients suffering from diabetic ketoacidosis and individuals undergoing dialysis who are treated with the iron chelator deferoxamine are at particularly high risk for developing mucormycosis. The most frequently observed clinical manifestation of mucormycosis is the rhinocerebral form, which affects the nasal cavity, sinuses, and brain. Clinical manifestation of mucormycosis zygomycosis. Mucormycosis, zygomycosis, is characterized by the invasion of blood vessels in both humans and animals. After vascular invasion, the infection may spread to other body regions, including the lungs and brain. Clinically, mucormycosis presents in 5 major forms: rhinocerebral, pulmonary, cutaneous, gastrointestinal, and disseminated. Sinus infections, sinusitis, are commonly observed and are marked by symptoms such as fever, headaches, nasal congestion, nasal discharge, and sinus pain. The infection may spread beyond the sinus cavities, leading to tissue necrosis of the mouth palate, disintegration of bone and cartilage, and destruction of the nasal septum. Patients may experience swelling around the nasal region, redness, erythema of the skin, and inflammation around the eye sockets. A bluish discoloration of the sinuses and eye sockets may appear due to oxygen deprivation, a condition known as cyanosis. Blurred vision and extended necrosis can occur, potentially resulting in significant facial deformities. When the infection reaches the brain, symptoms may include lethargy, seizures, slurred speech, partial paralysis, cranial nerve dysfunction, affecting face and eyes, brain abscess formation, altered consciousness, and coma. Paralysis of the muscles that control eye movement, known as ophthalmoplegia, may also be observed. When both the sinus and brain are affected, the condition is referred to as rhinocerebral mucormycosis. Pulmonary mucormycosis involves progressive infection of the respiratory tract. It presents with symptoms such as fever, unproductive cough that may include spitting of blood, hemoptysis, chest pain, and breathing difficulties, Dyspnea. Cutaneous mucormycosis affects the skin, leading to inflammation and hardening of the tissues beneath. Patients may present with skin redness, painful swelling, ulceration, and blistering. Tissue necrosis can develop, causing areas of the skin to turn black. Cutaneous mucormycosis can be aggressive and rapidly spreading, fulminant. Gastrointestinal mucormycosis, although uncommon, is not considered rare. Symptoms include abdominal pain and vomiting blood. Hematemesis. Lesions can form within the stomach or intestines, and the infection can lead to inflammation of the abdominal lining, peritonitis, and abdominal organs. Affected individuals may experience severe bowel pain due to a lack of blood supply, bowel infarction, and may go into hemorrhagic shock. Disseminated mucormycosis occurs primarily in immunocompromised individuals. Although rare, disseminated infections can be severe and involve multiple organ systems, including the brain, heart, spleen, skin, and others. In some rare cases, it may also affect the kidneys, heart chambers, heart valves, and bones. Laboratory diagnosis of mucormycosis, Rhizopus species. Specimen: sputum, pus, tissue biopsies, blood, serum, transbronchial biopsy, specimen sputum, pus. Tissue biopsies, blood or serum samples are collected for diagnostic purposes. Other useful samples include transbronchial biopsy, sinus biopsy, gastrointestinal tissue biopsy, and skin biopsy. Microscopic examination. A 10 to 20% KOH wet mount is used to detect fungal elements such as broad, non-septate or sparsely septate hyphae, sporangiophores, rhizoids, root-like hyphae, sporangia, and sporangiospores. Brown-colored, unbranched sporangiospores forming clusters at the tips of hyphal tubes may be observed. Occasionally, individual spores may be seen, which are ovoid in shape and range from hyaline to brown in color. The spores typically appear rounded with flattened bases. Cultural examination. Culturing on sabouraud dextrose agar, SDA, containing cycloheximide at 37 degrees Celsius leads to the growth of dense, cottony to fluffy colonies with a floss-like texture. Macroscopic features of the colonies include an initial white coloration that changes to gray or yellowish-brown as the colony matures. The reverse side of the culture plate shows pigmentation ranging from white to pale. Histological examination. Hematoxylin and eosin, H and E, staining is used to visualize the fungal elements in tissue samples. Wide, thin-walled hyphae that are hyaline and may be septate or non-septate are observed. The hyphae appear branched and non-parallel, aiding in the histopathological identification. Molecular diagnosis. Polymerase chain. Reaction, PCR, and genomic sequencing are employed for phylogenetic identification and precise differentiation of Rhizopus species. Differential diagnosis. Pulmonary mucormycosis must be differentiated from other fungal infections, particularly aspergillosis. Clinical evaluation of symptoms along with laboratory findings helps in distinguishing between these infections to identify the exact causative organism. Treatment of mucormycosis. The treatment of mucormycosis involves a combination of antifungal therapy and surgical removal of the affected tissues. Intravenous amphotericin B is considered the first-line drug of choice for managing the infection. If amphotericin B is not suitable or effective, second-line antifungal options such as posaconazole or isovuconazole, may be administered. Hyperbaric oxygen therapy is sometimes used as an adjunct treatment alongside primary antifungal therapy to improve outcomes. Depending on the specific causative agent involved, other antifungal medications such as voriconazole, fluconazole, and flucytosine may also be considered. Managing the underlying medical conditions contributing to immunosuppression is essential, and patients should be closely monitored for any contraindications during treatment. Selected species of Rhizopus and industrial uses. Among the 8 recognized species of Rhizopus, 3 are notably important for industrial and medical applications: Rhizopus microsporus var, Oligosporus, Rhizopus oryzae, also known as Rhizopus erizus, and Rhizopus stolonifer. Rhizopus microsporus var. Oligosporus is utilized in the production of valuable compounds such as fumaric acid, lactic acid, and cortisone. This species is also traditionally employed in the fermentation of soybeans to produce the Indonesian food product known as tempeh. Rhizopus oryzae, or Rhizopus erizus, is involved in the industrial synthesis of lactic acid and cortisone. It plays a role in alcoholic fermentation processes. Additionally, it is applied in the biosorption of heavy metals, which involves the passive uptake of chemical pollutants by biological materials. Rhizopus stolonifer, commonly referred to as black bread mold, is responsible for causing soft rot in fruits, such as strawberries, tomatoes, and sweet potatoes. Industrially, it is used in the large-scale production of fumaric acid, lactic acid, and cortisone. Thank you so much for watching. Don't forget to subscribe to my channel, press the bell icon button. Thank you!